Welcome to the topic psychosis. What is psychosis? So, a severe psychological syndrome marked by an impaired perception of reality, characterized by hallucinations and delusions. And the most psychoses have no identifiable causes and require long term drug therapy. What are the signs and symptoms of psychosis? Like hallucinations, delusions, suspiciousness, disordered thinking, and inappropriate behavior, abnormal movements or motionlessness, lack of emotional expression, stress, anxiety, and depression, sleep difficulties, social withdrawal, suicidality, or homicidality. What are the characteristics of the psychosis? They include the presence of some psychotic manifestations as thought disturbances, which is also called as the delusions. When it's a behavioral disturbance, it's called as bizarre or aggressive. When it's perceptual disturbance, it's called as hallucination. Then loss of reality testing or fantasy. Insight means completely or partially lost. They affect flat, blunt, or inappropriate. Speech becomes incoherent and the judgment becomes impaired or impulsive. These are some characteristics of the psychosis. Like we will discuss in detail now the delusions, hallucinations, illusions, paranoia, disorganized behavior, and difficulty relating to others. These are the characteristics. We'll discuss them one by one now. What are delusional disorders? An individual having delusional disorder holds a false belief firmly despite clear evidence or the proof to the contrary. So, what are the symptoms of delusional disorders? Feeling abused and exploited, comprehending threatening meanings into harmless remarks or the events, doubting the loyalty or the trustworthiness of the friends, having grudges for a prolonged period of time, answering readily to perceived slights, seeing, hearing, or feeling things that are absent in reality. Now, what causes these delusional disorders? Dysfunction in the working of the brain is one of the main reasons. Past incidents influencing of personality and temperament, depersonalization or lack of interpersonal communication with anyone, cognitive overload, facing perceptual disturbance, maintenance of self-esteem. All these causes the delusional disorders. Then is the hallucinations. So hallucinations is nothing but when seeing, hearing, or feeling something that is not there. So we are pretending this is there, but it is not in reality there. Like types of hallucinations includes auditory hallucinations, you hear something, visual hallucinations, you see something and it's not real, olfactory hallucinations, gustatory hallucinations, and the tactile hallucinations. So when we say auditory hallucinations, it's a false perception of sound. Gustatory is a false perception of taste. Olfactory is the false perception of smell. Visual hallucinations is the false perception of with eyes open in the lighted environment. Tactile hallucinations is the false sensation of the touch. Next is illusions. Illusions is nothing but the distorted or misleading perceptions of something that is actually real. For example, in this picture, we can see there is a bridge and there is a boat. So it's kind of an optical illusion that we can see both things in that. Next is paranoia. What is paranoia? It is a thinking and the feeling like you are being threatened, even if there is no evidence or very little evidence that you are. And paranoid thoughts can also be described as delusions or exaggerated suspicions. For example, believing that someone who made a nasty comment about you once is directing a hate campaign against you. So that is paranoia. The symptoms of paranoia includes panic, attacks, aggression, anger, fear, impulse, and suspicious. Next characteristics of the psychosis is the disorganized behavior. For example, the patient may wear the clothes in an entirely inappropriate manner and for no apparent reason, such as dressing up with the layers of clothes, including a hat, sunglasses, and several pairs of socks over the hands and the feet. Next characteristics of psychosis is difficulty relating to others. For example, the patient may become withdrawn from other people in a room or outside, show the signs of distress, maybe even turn combative if confronted or questioned, and the behavior may range from the total inactivity to the extreme agitation. Now, there are some drugs which can be used for the antipsychotic treatment. So their pharmacological classification includes first generation antipsychotics with the low potency, chlorpromazine, prochlorperazine, thioridazine. First generation antipsychotics with high potency, flufenazine, haloperidol, pimozide, and thiothixine. Then we have second generation antipsychotics. Some examples include aripiprazole, olanzapine, acinapine, quetiapine, clozapine, and paliperidone. So this is a little about the antipsychosis. Thanks for watching.